The fight against HIV/AIDS in Belize has been continuous, so much so that there's an average of just over 200 new cases recorded every year. The Ministry of Health's most recent statistics show that there are about 3,665 persons living with HIV, with over 100 having lost the battle against the virus. Several agencies have been working in Belize to reduce the number of infected persons with the aim to have zero new infections by the year 2030. The National AIDS Commission is one of them, and year-round there have been awareness campaigns on improved lifestyles and best sex practices among vulnerable populations, primarily those between the ages of 20 and 44, in which the prevalence of contracting the disease is greater.
We know that prevention has a lot to do with lifestyle changes. We also understand that Belize is one of those countries who are heading towards this strategy where we want 90. We want people to know they get tested, we want them to know their status, and we want them to get their treatment.
It's been almost 4 decades since HIV was first discovered. Over 35 million persons worldwide have died from the virus, and it affects the quality of life of as many others, including family and friends. But even with the campaigns, there is need for other forms of intervention, including oral medication, outside of what is already available to the Belizean populace.
We are charged, the commission, and you know the commission is comprised of many agencies, Ministry of Health, key population, LGBTs, young people, old people, and so we all need to understand what is the role of PrEP in terms of the prevention aspect of HIV. But you have those vulnerable groups, and if you have science that can support the prevention aspect of HIV, then why not use it? And so that is what it is this morning. We want to start the sensitization, and that is our role of the National AIDS Commission. We can't say that that's what it's going to do for the country. We have to start the conversation, and we also have to make sure that the government understands what is the value of putting this within the structure.
In the region, most CARICOM states have adopted the use of pre-exposure prophylaxis as part of its healthcare strategy in the fight against HIV/AIDS. Known for short as PrEP, it is a way to prevent HIV infection for people who do not have HIV but are at substantial risk of getting it. If a person is exposed to the virus, the medicine can work to keep the virus from establishing a permanent infection. So as a first step to the introduction of PrEP in the Belize health system, a sensitization session between stakeholders and Gilead Sciences was held.
Our goal and responsibility as a corporation is to make sure that education and awareness related to the advances in HIV treatment and hepatitis C and B treatments and other diseases are understood across the countries. And typically, like my responsibility with Central America and the Caribbean is to make sure that countries that aren't usually on the radar for making sure this kind of education reaches by global organizations, Gilead wants to make sure that we're there to fill that gap.
When taken consistently, PrEP has been shown to reduce the risk of HIV infection in people who are at high risk by up to 92%. But while it is used as a prevention tool, for greater protection, it should be combined with using condoms and other standard prevention methods. People who use PrEP must commit to taking the drug every day and seeing their healthcare provider for follow-up every 3 months.
PrEP is a component of a comprehensive HIV prevention program. It's endorsed by the WHO and other organizations. We can have all the great ideas, we can have all the great medicines, we can have the best intentions for response, but if we don't implement properly, that's where we see opportunities for lack of achieving, the ultimate goal. The reaction that I usually receive when I'm speaking with ministers of health and other key health decision makers around PrEP is, oh no, PrEP seems like it could, promote promiscuity, etc. And once ministries of health and other decision makers in health understand that it's a component of prevention, and that the program is quite comprehensive and specific. It is not an intervention for prevention of HIV that is standalone. It is a component of a larger prevention program.
But even at the discussion stage, there are psychosocial concerns which continue to plague the Belizean society and hinder the progress in the struggle against HIV/AIDS in Belize and the region.
It is important because the Caribbean is facing a serious threat with our HIV prevalence. We're the second highest next to Sub-Saharan Africa. And though our population might be an ant compared to theirs, it still hurts, and it will hurt us in the immediate future. For us to really address the HIV situation, we must address the discrimination that occurs on a daily basis on people with people from the LGBTI community. If we don't address that, we cannot move on to the next level. People are discriminated upon once they're diagnosed with HIV. That is a fact. So people are afraid to go and get tested. We have to stop being afraid of getting tested.
Duane, Moody for News 5.